everybody, it's me, Miss Foot Fixer. So we have this lovely toe. What do you think these purple bits are? And what do you think is underneath the nail? So if we look at this is her normal toenail. So we're just gonna look at that beautiful toenail. And then think about that. So if you know what it is, please comment in the comment section and I'll tell you if you're right or wrong. So what we're going to do today is we are going to conduct nail surgery on this toenail because so whatever it is that all of you know, we're going to do a local anesthetic. So what we're going to use is Scandiness 3% plain. I'm just going to zoom that out like that. So this is the local anesthetic we use. So we're just going to inject around 1 mil on each side. So let's just start doing that. And we really like to inject just where the soft tissue is here, the squishy bit. So it makes it really easy to inject. So I'm going to count to 3 and then I want you to do a big inhale. Okay, 1, 2, 3 and breathe. Well done. And the more squishier and the more fat you have on your big toe, the easier it is to inject. So you want to squeeze the local anesthetic in, maybe not fiddle around too much. And obviously it's going to be painful because you're injecting a local anesthetic into a big toe, and you slowly inject the local anesthetic, and then when you come out again, release the local anesthetic. So that's 1. And I'm just going to put another one in. I'm just going to go back in a little bit more, just one more in here because I don't think I did too much. I didn't get too much in the dollar. Okay, 1, 2, 3, and hopefully it's not as painful. 1, 2, 3, go in. Excellent. So that's my repeated one. And I'm gonna do this side. So depending on which way you look at, this is called the lateral, this is the medial. But if you look at this, if you look at the foot at this side, that's the lateral and that's the medial. So I'm just gonna do the second digital block. So again, it's just in there. 1, 2, 3, and breathe. Well done. She is the most gentlest person that's screaming. She's doing really good. Well done. Well done. Well done. She had a kid, so she's fine. So the toe is anesthetized. So what we're going to do now is we're just going to cover it with some gauze and then wait. It's just time now, waiting for it to work. So we had to do a bit more anesthetization because when we did the digital, it didn't go numb. So we just did some topicals. And what we found is that her nail is so infected, it doesn't like to come off in one piece. You can see all of that nail fungus underneath. So we're just loosening everything up. So when I do remove the nail, it's a lot more easier. Put the elevator underneath the nail plate just to lift up the nail. And you want to try to not cause too much nail bed damage underneath. But the quality is like so, you can see it's not a very solid nail. It's so soft and brittle. Because ideally you want to have it all off in one go. But you can see how loose it is. It's very, you would think that this is a very solid piece of nail. But when it's infected like this, so you can see that all that infection in that nail, that is not good. And you can see all the infection on the nail bed too. So what we're going to do is just peel that off as much as possible. Again, just peel that all the way out like that. All the way in there. So much fungus. feel how deep everything is. See, that's coming from the nail matrix, that extra whole piece of nail there. Look at all that stuff. All that fungus. You want to remove as much of this away as much as possible. Make sure you get all the nitty-gritty stuff. Again. And then obviously use the stuff on the side. So much still inside. So I'm just concentrating because there's so much to do on this nail. Everything's quite stuck inside. So I just really want to really do a deep, good clean of everything so that we really have a good clean out, because like I said, it's so badly infected that you can't really see a healthy nail at all, which means that the nail fungus is just overtaking the nail plate. And if we leave any of it there, fungus can come back. happy with that. Looks good, nice clean. So yeah, kind of stuff. And then just really want to wrap that up because it's gonna bleed. So we like to have loads of dressings. Not the most comfortable, to be honest, for a patient when you have lots of dressings, but it keeps the patient calm because there's a protective layer. It contains blood, so there's less kind of like crazy calls about I'm bleeding through and things like that. It will bleed through, so don't worry too much about it if it does bleed through because obviously you had a surgery. But the main thing is that it is protected, it's enclosed, and then you're given advice on how to take good care of it itself. So just a nice pokey dressing like that. Fantastic. Thank you very much for allowing us to film, and thank you very much for watching. Hope you guys enjoy. Remember to comment to see what this nail is, and also remember to subscribe if you haven't subscribed. Bye. Thank you. Bye bye.